it's Dr. Jenny here, and we are talking today about the thyroid and specifically what symptoms women face with hypothyroidism. And so I think that's important because some symptoms that people experience they're not specific to men or women, but it probably doesn't surprise you that women respond to thyroid issues a little bit different. So let's dig in and talk about what thyroid dysfunction looks like in women. So it's more common for someone to have an underactive thyroid, which is hypothyroidism, than it is for to have an overactive thyroid, although that can happen too. But certainly the majority of thyroid issues are an underactive thyroid. That's known as hypothyroidism. And the autoimmune version of that is called Hashimoto's. So if you hear those terms, that's what that means. So what do people feel when they have a slow or underactive thyroid? Fatigue is the number one. Just tired, that fatigue you just can't shake. Weight gain, trouble maintaining a healthy, consistent weight. Brain fog, cold intolerance, or just feeling cold all the time. Dry skin, hair loss, and constipation. Some of the other symptoms that aren't quite as common are depression and joint pain. So I certainly see those too. And then what are the signs that women face that men don't have to deal with? So this probably won't surprise you when I tell you what those are. They're infertility and menstrual irregularities. So why in the world would your thyroid cause menstrual dysfunction or infertility? So yeah, you heard that right, that can happen with that. So let's talk about why that happens. When you have a decrease in your thyroid hormones, those are T4, T3, those are, if you've heard of those are your thyroid hormones. A decrease in those hormones can cause an increase in a hormone called prolactin. So it can also affect your luteinizing hormone and can cause a loss of progesterone receptor site sensitivity and decrease in the sensitivity of your follicle stimulating hormone, or FSH. So all of those things put together can compromise ovulation. So if you don't ovulate, you can't become pregnant. So the moral of that story is that thyroid hormone has an effect on hormones that leads to changes in the way that you ovulate and cycle and all of these things. And so that can absolutely impact not only your cycle but your ability to become pregnant if you're trying to do that. And those hormonal changes can also mess up the communication with your pituitary gland, which is the gland in charge of most of your hormones. So you get signaling issues, and hormones don't get released in the right amount at the right time of the month, and all these other things. And that is the connection between your thyroid and menstrual issues and infertility. I do see that quite a bit, so I thought we should talk about that. So now that we've talked about menstrual issues and infertility, let's talk a little bit about pregnancy. Many of the women that I see that come to me that are looking for help with their thyroid, they discovered the problem shortly after the birth of a child. And it usually goes something like this. I felt like something was off. I felt great while I was pregnant, but then a few months after I had my son, it's like the wheels fell off the bus, and I started having all of these symptoms, all the things we talked about: tired, fatigued, and a lot of them chalked it up to postpartum depression. And maybe some of that is there, because that is absolutely a very real thing that women deal with all the time. But some of them, they didn't make the connection that, hey, all of these things could be coming from my thyroid. So let's unpack that a little bit and talk about what that looks like and why that might happen. The first thing to note is that your demand for thyroid hormone increases when you're pregnant. So just like your requirements of a lot of things, there's more demand on your body, so you have to produce more of it. So you see women that were already just barely on the line of not feeling the symptoms of a struggling thyroid. They're right there at the point where they're starting to feel it, and then they get pregnant, they have more demand, so now they just really can't keep up. So it pushes them over the edge. I think that happens probably quite a bit. And then the other thing is that when you're pregnant, you have an increased level of progesterone. And progesterone does a couple of things. It's an anti-inflammatory substance, which is great. It makes you feel less pain, less inflammation, and we know that inflammation doesn't feel good, so that's good. But then it also helps keep autoimmune conditions in check because it inhibits the T helper type 1 pathway. So that's a big fancy way to say that there's some protection against autoimmunity while you're pregnant. And if you want to visit my blog at drjeni.com/blog, there's a reference to that. You can read the whole article if you want. But that's important because 90% of the cases where a thyroid is slow, there's an autoimmune root cause to that, meaning that 90% of the time, hypothyroidism is Hashimoto's, which is an autoimmune condition. So that explains why a lot of women really feel better while they were pregnant, because that is they get a little reprieve from that autoimmune breakdown because of the progesterone and the inhibition of the T helper type 1 pathway. So you've got that. But then what happens is pregnancy ends and your progesterone levels, they go whoosh, and they just bottom out. And you can notice that when your hair starts falling out. You've probably seen that if you've had a baby. There's just a lot of hormonal changes that they kind of do a lot of things, and hair falling out is one of them. But that loss of progesterone, it ends that anti-inflammatory effect and the reprieve from the autoimmune breakdown because of the T helper 1 pathway. So then we pick back up and we say, oh, now we have that thyroid problem that we're starting to see creep back in, and we're feeling that the effects of that quite a bit more after pregnancy. And just that combination of all of the changes in hormones, and if you were already, maybe you're predisposed to have a thyroid condition, it runs in your family, and then all of a sudden there's more demand for it, and then you throw in all the hormonal changes. It's just that perfect storm that starts that issue. So I do see a lot of women that will say, you know what, after that baby was born, whether it's the first child, second child, subsequent pregnancies, whatever it is, there was something about that pregnancy that triggered that, and now I feel like I'm struggling with my thyroid, or that's when they were diagnosed. It finally showed up out of range on a blood test. So thyroid conditions are so common that the American Thyroid Association is now recommending that all women over the age of 35 be screened, and that they repeat that screening every 5 years. So that's a big deal. In fact, autoimmune hypothyroidism, Hashimoto's, is the #1 autoimmune condition in the United States. So it is a big deal. It affects a lot of women, and it really makes them feel bad, and it really takes away their quality of life. And I know this because I talk to women every day about this issue, about their thyroid. And so while I love that idea that we should be screening women starting at 35 and even younger when it's an issue and they tell you certain things, I think there's nothing magic about that 35. But I do think we should be screening women. But I don't agree with the recommendation of just looking at one value called a thyroid stimulating hormone, or a TSH number on a test. That is, so when the American Thyroid Association says we should start screening, that's what they mean is, let's look at this number. Okay, so if you've watched any of my other videos, you'll know that I say this all the time. That one little number is just this tip of the iceberg, and it's sometimes normal for years while you actively have a thyroid that's breaking down. And if you had looked at all the values and done a complete evaluation of the thyroid, you would have caught that so many years earlier. And just when you catch it earlier, the results and the treatment it's so much better when you can manage it early. So I put some pictures on the blog if you want to go back and look at the pictures. But um, of, you know, do you want just a TSH looked at with a reference range that's really wide that says, oh, pretty much anything between 0.45 and 4.5 is normal? Or do you want someone to come along and look at 11 different markers and say, okay, that reference range is really not where health lives. We need to tighten it down and look at where optimal values are and look at it through a functional lens and really evaluate the whole thyroid and do it in a way that asks the question, are these levels healthy or are they simply not quite a disease yet? So that's how I evaluate a thyroid, and I do it a lot, and I find things very routinely that were missed in just a simple TSH screen. So then we can help. The results are better, and it's more helpful to you as a person with this or struggling with this. And so, as you can see here, we have women that can be affected in different ways than men because of the hormones that play into this. So I just wanted to take a few minutes and unpack that and explain what the differences are in women that are affected by a low thyroid versus a man and how that would look. So I hope you found this valuable. Thanks for tuning in.